22 News is working for you this month with a series that examines colon cancer. In the first part of the series, we took a comprehensive look at this type of cancer and how it spreads in the body.
And today in part 2, 22 News reporter Melissa Torres gives us a look at preventative measures and treatment options.
Healthcare experts believe that making conscious choices about the things that we eat and put into our bodies can help minimize the chances of developing this form of cancer. Some of the most common questions that a doctor may ask you when you go in for a routine appointment is, are you getting your recommended servings of fruits and vegetables? How often do you exercise? Or do you smoke or drink? The answers to these questions, based on our lifestyle choices, have a direct impact on our health.
Physical activity, staying active, eating healthy and balanced diet, those are the things.
Dr. Armin Asik, an oncologist at Bay State's Damore Center for Cancer Care in Springfield, recommends a diet low in animal fats and high in fruits and vegetables to reduce the risk of chronic diseases and cancers.
Being active, exercise, at least it's well known that at least 3 times a week, half an hour exercise. It can be just walking outside. That prevents cancers.
Overall, the most effective way to reduce your risk of colorectal cancer is to get screened routinely, beginning at the age of 45. When it comes to cancer prevention and cancer management, it's also vital to make health-conscious choices.
Sometimes patients, when they come in, they already have cancer, and they say, you know what, what's the point, doc, of doing anything now? And tell them, no, it's never too late. So even in stage 4 cancers, there's always benefit to basically make those changes, and it helps with everything.
Once someone is diagnosed with colon cancer, there are multiple questions that need to be answered before a physician can determine colon cancer prognosis, medications, and treatment. But the first step is to remove the cancerous cells through surgery.
So stage 1 cancer is 95% cure with surgery alone. So we don't do any other treatments other than follow-up.
If someone has a more advanced stage of cancer, the reoccurrence risk is greater. So the standard of care is to offer chemotherapy.
The median survival time, which used to be maybe a year, maybe a year and a half, has now moved to 3 years, maybe 5 years. And this is because of these newer treatments and other options available, so we can use one treatment after the other.
Cryosurgery, targeted therapy, and immunotherapy are some of the many treatments that can be implemented. But treatments are not one size fits all. Treatments are typically done in a stepwise fashion to determine which one is the most effective for the individual.
Other options available, so we can use one treatment after the other. If someone fails a certain treatment, then we go to the next treatment. So that gives patients obviously survival advantage, and also many of these treatments they do not have a lot of toxicity. So these patients who are living longer and they still have good quality of life.
Next week, for the last part of our series, we are going to take a look at the support available for those on their cancer journey and the emotional and physical toll it can take. Working for you, Melissa Torres, 22 News.